Good afternoon, everyone. My name is Jerome Bailey. I'm with the ESRD NCC. Thank you for joining us for the first ESRD NCC Patient Education Quickinar. The ESRD NCC Quickinar events are held in partnership with the Centers for Medicare and Medicaid Services. We are hosting these 30-minute events weekly. They feature patients and professional subject matter experts from around the country, sharing how they or their organization are coping and combating COVID-19. Before we get started, I want to let you know this call is being recorded and will be posted to the NCC COVID Quickinar webpage, usually within 3 business days. So let's take a look at the agenda for today's call. We have 2 speakers, Howard Bendell, a kidney transplant recipient, and Alyssa Souza, peritoneal dialysis nurse. You will hear their perspectives on using telehealth to visit your doctor. We will be asking you to send us questions you have for Mr. Bendell and Mrs. Souza through the WebEx chat feature later in the call. We have a new resource tool we are excited to announce on today's call. We'll also share the ESRD NCC COVID-19 resource webpage link, and we'll tell you about the next COVID-19 Quickinar event. So what's this call about? You'll hear from ESRD patients adapting to COVID-19. You will hear real-world experiences for patients to put into use, and we'll share how you can engage in weekly calls on varying topics. Slide 4, please. So we have 2 speakers, as I mentioned, for today's call. Our first guest is Howard Bendell. Mr. Bendell is a recent transplant recipient from Miami, Florida. When I say recent transplant recipient, he received his new kidney 2 months ago. So prior to his transplant, Mr. Bendell did in-center hemodialysis for 4 years. He is a registered resort professional and a past director of the American Result Development Association, and has been a frequent speaker and contributor of editorial content on the subject of shared resort real estate. He is a graduate of the A.B. Freeman School of Business and Tulane University. So welcome to the call, Mr. Bendell.
Thank you very much. It's a pleasure to be with everybody today.
Thank you. So first question for you. Can you describe your first experience with telemedicine? Were you nervous using it the first time?
It's interesting because my first exposure to the concept of telemedicine really came as a result of the COVID-19 situation. Down here, my provider network is actually associated with the University of Miami, and the university essentially closed down its clinics for non-essential visits, if you will. And as an alternative, they made available the concept of telehealth. And because I had just received my transplant and I needed to follow up with my primary care physicians, that was the mechanism that we utilized in order to put that into play. Now, fortunately, in my case, I have a long-standing relationship with that provider. So just knowing that I already knew who I was speaking with and I was already very comfortable in a face-to-face, day-to-day type of a relationship with him, it sort of took any nervousness or trepidation away. But I will tell you that I was very happily surprised with the results of the experience because it was very natural.
So how do you prepare for using telemedicine?
From a preparatory standpoint, to me, it's really no different than preparing for any regular in-office visit that you would have with your doctor or your providers. It's always been important to my doctors that that we take advantage of the time that they have So I generally would go in there with a list of questions already set aside, so I knew exactly what it was we were going to address. Yeah, and certainly having that in the telemedicine environment made that visit all the more productive. The one thing that I would encourage everybody who's considering this, though, to take into account is you want to sign on to your system when you are going to use telehealth, probably about 10 to 15 minutes in advance of the time that you would expect to start your appointment with your provider. That will take care of making certain that there are no technological issues and that your connections are all properly in place.
Now, did you have any technology hiccups, or what challenges did you have, if any?
I would say that the very first time that we did this, there were a couple of challenges. The same way that I was learning the system, the provider was learning the system. Certainly by now, I would anticipate most of your providers have done this a few times so that they're more comfortable with it. But for patients or for participants doing it for the first time, it takes a little getting used to. But if you're familiar with using other video conferencing types of capabilities, perhaps Zoom or the WebEx features that are available, then it's going to become somewhat second nature to you.
Go ahead.
The single biggest challenge I think that I had was I didn't anticipate the check-in process that the university had put in place in order to get everything ready for the actual appointment. So that's the reason why that extra 10 or 15 minutes in advance is going to come in and it's going to benefit you.
And you were able to resolve that issue by just logging on earlier.
Correct. As a matter of
how comfortable? Go ahead.
I was going to say, as a matter of fact, in my case, the university actually called me the day of the appointment and asked me to go on about 15 or 20 minutes early, just so that they could take care of those issues.
So, how comfortable are you discussing your needs via telemedicine?
Like I said before, it was very comfortable for me. And I've done this now probably 3 or 4 different times. Twice with my existing provider, and twice with actually new specialists or new providers that I just met for the first time in the telehealth environment. But I will say, like I said in the forefront, for me, it was really no different than an in-office visit. The only difference is that I'm on one side of a screen now, and my provider's on the other side. But we're still talking with one another as though we were 2 or 3 feet away from one another in a room.
So, as a patient who has used telemedicine, what do you see as some of the benefits of using this tool? Well,
it's certainly very convenient. Once you get comfortable with the process, convenience is invaluable, quite honestly. The whole idea of not having to drive, if you're familiar with Miami, I live in the south part of the city. My providers are downtown. So for me to go from where I live or where I work to the downtown area, in the pre-COVID environment would have been a 45-minute to an hour drive. Today it's a half hour to 40 minutes. But either which way, to not have to drive that distance, and more importantly, to be able to take advantage of that time, is a great value enhancement to me. So I see that as a huge benefit, and frankly, a convenience.
All right. Thank you, Mr. Bendell. I'm sure we're going to have some questions from the call participants. in a minute, so I'm just going to ask you to hold on while we talk to our next guest, who is Alyssa Souza from Crystal River Dialysis Center in Crystal River, Florida. Ms. Souza is a peritoneal dialysis nurse. She began her career in 2016 as an in-center hemodialysis nurse. She currently works with 23 patients. Ms. Souza enjoys implementing evidence-based practices and new research into everyday care of her patients. On a personal note, Ms. Souza and her husband are expecting. She is 6 months pregnant. So, Ms. Souza, how are you today? Thank you for joining us.
Oh, thank you for having me.
Great, great. So for patients who have never used telemedicine, what recommendations do you have for their first time using this communication tool?
I would say being prepared, most importantly. It's much different than just showing up to the doctor's office. When you're doing telemedicine, there's a sense of more so responsibility, much like our other speaker was saying, that you should log in ahead of time, make sure that you're familiar with the whatever platform, be it an app or a link, whatever you may be using. Make sure that you get comfortable using the device and using the platform before the visit to kind of avoid any technical issues or if it's a connectivity thing. And most importantly, asking questions. If you're not sure, if you're not comfortable using like an app, or I know from where I'm from, we're from this tiny little place here in Crystal River, Florida. Our population isn't, they're not too tech savvy geographically, so it really took my partner and I some time to get these patients acclimated to really their smart devices to be able to use our platform. So just asking questions, calling ahead if things aren't making sense, making sure that you have the resources before you sign on.
Okay. So what are some techniques for patients and providers to maintain their relationship while using telemedicine?
I would say the same if you were meeting face-to-face. Keeping your appointments just as you would, rescheduling your appointments. There's a trust between patients and provider. I would say the same rules apply. Just, the platform is different, but the care is all the same.
Okay. How should a patient prepare for using telemedicine besides getting used to the technology, practicing with the technology? Outside
of that, I think it would be great, because what I've found is that the telehealth visits or teledoc, telemedicine, what have you, seem to go much quicker than a traditional face-to-face doctor's appointment. Sometimes people go to the doctors and they could wait a half an hour to an hour before they even see the doctor. I think really preparing a list of questions or blood pressures or whatever the issue may be, depending on the reason for the visit, having those things ahead of time, especially questions and concerns that you want to discuss, because I felt as if the few times that we did our visits, it was kind of like we went over what we had to, but it is different. Like I said, the care is the same. It's remote, so it's more convenient, but making sure that you cover those things while you are doing your telehealth or teledoc visit with your doctor.
And what would you say is the best setting for using telemedicine?
I would say in any area where you feel comfortable enough to discuss your personal health information. Even though you're home or wherever you may be, you want to make sure that the same rules apply just as if you were in a doctor's office with the door closed. You want to make sure you're around people who you feel comfortable with discussing your health information. You're in a quiet setting where there's not a lot of foot traffic. And my partner and I were talking about connectivity. You want to make sure that you're somewhere in your home where you have a good connection to see your healthcare provider.
And as a provider, what do you see as some of the benefits to using telemedicine?
The remote access, for sure. You know, like he was saying, how it could be kind of a haul from where he lives to his doctor's office. Not having to leave your home, be it travel time or if it's a financial thing, or maybe sometimes people feel as if they're just too sick to leave home, which kind of, you know, it would make sense for them to go to the doctors, but it does happen. So for them to be able to reach out to their healthcare provider from a remote setting is most convenient, I would say.
And you discussed some of the challenges a little bit. Can you talk a little bit more about the challenges from both, you know, that you see patients are having and providers are having, and what are some of the workarounds from those challenges?
Again, with technology, just getting acclimated because it's all brand new, just as if, you know, at one time it may be new to a patient, but it was brand new to a healthcare provider at the same time, and it just takes time, you know, getting comfortable with the app, signing in early, making sure that you feel good about it before you see your healthcare provider. I would say some workarounds would be, if they can, healthcare providers showing the patients how to navigate the apps. I know our app that we use with DaVita does certain things as opposed to other teledoc apps and things like that. So making sure that you're comfortable with your app and just playing around with it, really, just like anything else. In an ideal situation, having like a super user or having access to the technical support line, resources and things like that is really, I mean, given our situation in the world, I think would be the best workaround.
All right. Thank you, Ms. Souza. Now, for our audience members, if you have a question for Mr. Bendell or Ms. Souza, please send your questions to all panelists in the WebEx chat box. And we will start with, we have a question for Howard. Do you feel you were given the same amount of time to ask the questions that were important to you? Do you think this would work if there was not a video screen for physician and patients to see each other?
Interesting. I actually think in my case, the telehealth environment provided me with a greater degree of time and attention from the provider than if I were in an in-office situation. I say that because he was truly captive and focused on me. I was focused on him. There were no interruptions. There was no way to have any interruptions. So I really did get the benefit of his undivided attention. And that was something that I genuinely appreciated. Can you help me with the second part of the question once again, please?
Sure. The second part of the question is, do you think this would work if there was not a video screen for physician and patient to see each other?
Probably not as effective. You know, being able to see one another, I think, was key. Certainly, and I'm going a little bit off topic a little bit, but if something were to arise where you were trying to describe something on your body that the doctor would generally need to see, having the screen capability, you can essentially show it to him right on screen, whereas if there was no video associated with it, trying to describe what that item might be or how it was affecting you might be a little bit more challenging. But overall, I would say that having the video would be definitely an advantage.
Thank you, Howard. Again, if you would like to ask a question of the panelists today, please send your question to all panelists in the chat feature on WebEx. And I think, Matt, I'm going to need a little help with the next question, and it is, are most platform device agnostic?
Thanks, Jerome. Hey, now, I'm actually going to direct my question to Howard on this one. Howard, did you connect to any one of your events using a different device, or was it your phone, or was it your PC? What was your experience with your technology?
I've connected with my laptop as well as with my iPad.
Okay.
And both have worked just as effectively.
And that's kind of where I was going to go with that answer, Jerome, is that a lot of these platforms, and especially the ones I've used personally, do operate on iPhones or Androids or PCs. Now, it certainly depends on the platform, but most are designed to do that, yes.
All right. Thank you, Matt. I've got another question. This is for either Ms. Souza or Howard. Have patients brought up concerns about not actually getting a physical exam from the physician?
I would say yes and no. Yes, because, for example, much like he was saying, when you have that screen, you could show, an exit site for dialysis or, something of that nature. It could be a bruise or something like that. But you still take away that hands-on, listening to lung sounds and things like that. I think it depends on the situation. If it's a regular routine visit, fine. But if it's obviously something that needs more follow-up or needs to be more in-depth, we've had, mostly from our physician, she would prefer to bring the patient in. With everything going on in the world, obviously, we want to keep our patients safe, and the best way to do that is to keep them home. So, like I said, it really depends on the nature of the issue, if there is an issue.
Okay. I think we have time for about 2 more questions, and one that came in through the chat is, can you do telehealth just by phone without a video conference?
We have. Like I said, not everybody has a smartphone or a smart device. So we've had video conferences, and patients have sent in, documentations or things like that. And what we've done is, depending on platform, if we can't send the patients their labs, we've actually been mailing them. So you kind of have that advanced, teledoc, telehealth part of it, and then we kind of go back to our old ways of using mail and things like that. So you could, like I said, it depends on situations, but we have had phone conversations with patients.
Oh. And I think this is another question for you, Alyssa. Are you able to troubleshoot with patients to your satisfaction using telehealth?
Absolutely. I think, and like I said, I don't know every single platform out there, but I know the one we use specifically, it's really user-friendly, and a lot of them, I'm sure they're designed that way. Very simple. So it's easy to, and there's like a patient portal, and then there's a provider portal. So we have access to both, so we can call the patient on the phone or whatever, and step-by-step walk them through it. It's very, very, very user-friendly.
Yeah, okay. And I'm going to make time for one more question. How are physical tests such as blood pressure and temperature assessed?
So what we have our home patients do, and a lot of our ESRD patients have a history of hypertension anyway, so they're familiar with blood pressure medications and taking their blood pressures at home. So what we did was we actually had our patients do a weight, a blood pressure, and a temperature all from the morning before they saw the physician. We had them log in a little bit early to make sure that they could get on, and then as soon as we got a connection, and sometimes we didn't, things don't always work out, so we would call them on the phone. Before we went over the labs and addressed issues, the patient read us their most recent blood pressure, temperature, and weight.
All right. Howard, Alyssa, thank you both very much. I appreciate you both being with us this afternoon to answer some of the questions that we got from our audience. Now I'm going to turn the call over to Matt for a little introduction to the Kidney Hub.
Thank you, Jerome. The ESRD NCC and CMS are very excited to talk about the kidneyhub.org. I'm going to be very brief on this, but this is a new tool that we've created. It's designed primarily for patients, but for professionals as well. This tool is a web-based tool that is mobile-friendly, meaning it's designed to display in your smartphone or on your iPad. And when we developed this, we got the assistance from a lot of our patient subject matter experts that relayed information on what they thought would be important to have on a tool like this. So one was that it was very mobile friendly, it was cleanly designed. You can see an image of what it will look like if you bring it up on your smartphone. Most importantly, and especially in this time with COVID-19, there are links to important resources on there, such as COVID-19 emergency resources. Now, what you might see here on this screen might be different tomorrow or the next day because this is constantly being updated with new resources. But for right now, COVID-19 resources are displayed at the top of the screen. Additionally, this mobile tool features patient-created resources on a bunch of topics like infection prevention and well-being and transplant and a bunch of others and the kidney community emergency response program, et cetera, et cetera. A lot of those resources were selected because they're either generally very important or very important in the times that we're in right now. And one last thing that we've put on there is you may or may not know every new ESRD patient gets a mailer from CMS. All of the materials that are available in that mailer and have been historically available in that mailer are available on this mobile tool. So we're very excited about it. We hope that you pick up your smartphone or your tablet and go out to the kidneyhub.org and take a look at the resources that are available out there. There is a contact form, so if you see anything that you like or don't like or a suggestion for something, please feel free to send us your feedback. And Jerome, that's all I wanted to say about that.
Thank you, Matt. Very much appreciate it. We also want to tell you about the ESRD NCC COVID-19 resource page on the ESRD NCC website. This page is also constantly updated. In fact, we put 3 new resources up there today. Resources like the doctor will see you now, Telemedicine makes it easy. That's a new handout that was created. We have 4 ways to empower yourself to cope with COVID-19, both available in English and Spanish, and then the 5 urgent reminders about COVID-19 for individuals on dialysis. So if you go to the ESRD NCC webpage, the link is right there at the top to the COVID-19 resources. Next slide, please. So our next COVID-19 awareness event is tomorrow. It's for the COVID-19, it's for providers. We will hear from David Arrieta. He is the Chief Financial and Operating Officer for Nephrology Associates of Nashville. He will be talking about operationalizing telehealth at the nephrology practice. Again, you can visit the esrdncc.org/quickinars webpage to register for tomorrow's event. And again, it's at 5 p.m. Next slide, please. So we want to thank everyone again for participating on today's call. Our speakers, Howard Bendell and Alyssa Souza, we very much appreciate your insights. For more information on the COVID-19 resources, just go to the ESRD NCC website. If you need to contact us, our telephone numbers are on the screen. We look forward to bringing you more in-depth conversations about medicine and COVID-19. Thank you, everyone. Have a good day.